in the psychiatric fraternity. Formerly, she was at PGI Chandigarh as professor and head, and she's an internationally acclaimed psychiatrist and researcher. Ma'am, we are indeed honored to have you here in Prayagraj today for this Dr. Anup Tripathi oration. Thank you.
Good afternoon. Respected chairpersons, thank you very much for this kind introduction, and I feel honored to deliver this oration in the name of Dr. Anup Tripathi, about whose life and work I just learnt, and this is an example of such an inspiring life and dedication, and where one is able to overcome all the difficulties despite all odds. And this is what keeps all of us, everyone, going. So with this, I would like to, today I've been given this topic of talking about adult ADHD. Adult ADHD is short form for attention deficit hyperactivity disorder. Now, we know this condition, ADHD, as a condition that occurs and starts in childhood. It's a very, very common condition that is seen in children, and this condition is a kind of a description. It's a descriptive condition, sort of a syndrome, so to say, that comprises of a triad of disturbances. This is hyperactivity, inattention, and impulsivity. Now all this occurs together, and that's what we call as ADHD, and it's a neurodevelopmental disorder. That means it's present right from birth and occurs during the course of development of the brain, and it's a neurobehavioral syndrome, so arises from the disturbance of the brain and described or diagnosed on the basis of behavioral disturbances or patterns that we see in children emerging. And this is one of the most common neuropsychiatric disorders of childhood, most extensively studied and researched condition in child psychiatry. And now gradually over a period of time we are realizing that this condition, when it occurs in childhood, in large majority, in many children, when they grow up to be adults, the condition stays. The manifestation may change, presentation may change, the dysfunction that it causes may change, but the condition underlying can stay the same. So and when it occurs in childhood, in adulthood, when we see it, it causes a considerable degree of impairment in their functioning, in their social life, occupational life, interpersonal relationships, and so on. Just how common is ADHD? See, basically, when we look at the prevalence rates, there are highly variable prevalence rates have been reported. Global prevalence in the community studies, global is all over the world, that ranges between 2 to 7%, and average is around 5%. So there are countries and places where the prevalence rate is very low, and there are places and countries where it's very high. For example, in USA, in 2003, the prevalence reported is 7.8%. In 2007, 9.5%. 2011, 11%. And as opposed to this, in Indian population, the reported rate in the community study, population study, is about 2%. So in America, the rates are much higher. Not only is higher, it's also increasing over a period of time. Rates are increasing. Now when we look at adulthood, global prevalence described is about 2.6%, and the condition is described more in resource-rich countries. So more developed countries and rich countries, it occurs more, and in poor countries the rate described is low, and in America it's about 4%. So this tells us something about about this condition, why in poorer countries the rates are lower, and in developed and rich countries the rates are higher. This has something to do with the environmental etiology or etiological factors that we will talk about. In adults, the features of ADHD, as I said, are slightly or little bit they're different from children. This is basically the triad: hyperactivity, impulsivity, and inattention. That remains the same, but its manifestations begin to change. In childhood, जो ओवर एक्टिव बच्चा है उसकी डिस्क्रिप्शन क्या होती है? अगर आपने देखा होगा कि बहुत चंचल है, टिकता नहीं है, फिजिटी है, भागता रहता है, उछल कूद करता रहता है, उसको बिठाना पड़ता है, वो बिल्कुल भागता है बिल्कुल, और वो बच्चा ध्यान नहीं देता है, बिल्कुल बात को अनसुनी कर देता है, और इम्पल्सिव है, सडनली जंप्स, सडनली काइंड ऑफ रशेस ऑन द रोड, स्नैचेस थिंग्स, वो इम्पल्सिवली एक्ट करता है. सो दिस इज व्हेन द इट्स ए चाइल्ड. बट व्हेन देयर इज दिस पर्सन, दिस चाइल्ड grows up, and then how does this syndrome manifest in adulthood would be slightly different, and I'll come to that in detail. And in adulthood, symptoms of hyperactivity become less common. वो टिक जाता है, इतना चंचल भाग दौड़ उछल कूद नहीं कर रहा, but inattention and impulsivity they stay. Now how does inattention, we'll talk each of these kind of underlying disturbances, how does it manifest in real life? Inattention is lack of focus on a task, especially cannot stay focused for a long time, easily distractible, disorganized. इस तरह के जो, now this is adult description, also applicable to children, but the manifestation you will see that how in their different area of activity the disturbance appears in a different way. तो इस तरह के जो लोग होते हैं adult ADHD inattention से, वो disorganized होते हैं. उनका कमरा, उनकी कबर्ड, उनका जो अपना पर्सनल सामान है बिखरा रहता है, एक जगह ऑर्गेनाइज नहीं होता. दे कांट प्रायोरिटाइज टास्क, कौन काम पहले करना है, कौन पीछे करना है, अगर 4 काम करने हैं कैसे करना है वो नहीं कर पाते. एक शुरू किया छोड़ दिया, दूसरा शुरू किया उसको छोड़ दिया. दे डू नॉट कंप्लीट द टास्क. दे आर फॉरगेटफुल एंड ओमिट थिंग्स, लूज थिंग्स, क्योंकि वो इतना बेध्याने में रहते हैं कि वो कहीं भी कुछ भी रख देते हैं तो वो उनकी गुम जाती हैं चीज़ें. दे आर फ्रीक्वेंटली काइंड ऑफ losing and forgetting things. Appear to be daydreaming. Time management की प्रॉब्लम रहती है उनको. They cannot kind of plan something as per schedule or requirement, and so they would miss appointments or deadlines. काम अधूरा छोड़ देते हैं. Often late for anything. कोई काम दिया तो या लेट पहुँचेंगे या तो पूरा ही नहीं करेंगे. And then other things which is very common is problems related to driving. उनके जो ADHD के जो लोग होते हैं इनअटेंशन की वजह से ड्राइविंग में उनको मुश्किल आती है. दे विल अप्लाई सडनली ब्रेक, क्योंकि वो दे आर नॉट एबल टू जज द रिलेटिव स्पीड ऑफ द अदर व्हीकल्स. सडनली ब्रेक करेंगे, सडनली एक्सेलरेट करेंगे, रास्ता भूल जाएंगे, जाना कहीं है, अपने बेध्याने में किसी और रूट पे निकल गए. इनअटेंशन टू रोड, ड्राइविंग एरर्स and so on. So due to this they frequently get those traffic challans. Impulsive act. Impulsivity is to act without thinking, without forethought, without understanding or judging the consequences कि हम क्या कर रहे हैं, without thinking or planning. So they will interrupt, suddenly barge, कहीं भी अंदर चले जाना. Excessive shopping, sense of hurry, cannot wait, urgency रहती है उनको. Poor decisions, क्योंकि impulsive हैं, बिना सोचे समझे कुछ भी कर लिया, ज़रूरत है नहीं है कुछ भी कर लिया, कुछ भी कह दिया, कुछ भी खरीद लिया, कुछ भी कहीं भी चले गए. बाद में सोचते हैं कि ये काम ठीक हुआ या गलत हुआ. Premature termination of relationships. Very quickly they will enter into relationship and quickly break it also. Getting bored easily. ADHD के जो लोग होते हैं वो उनको किसी भी चीज़ में बहुत जल्दी बोर हो जाते हैं. They frequently they need they change in the stimulus environment कि अब ये नहीं, अब ये बोर हो गया, अब कुछ और किया जाए. And they quit jobs without having any alternative. एकदम इम्पल्स में आकर के गुस्सा आया, नहीं पसंद आया, कुछ आया और रिज़ाइन करके आ गए, और उसके बाद में ये सोचा नहीं कि अब करेंगे क्या, इसके बाद क्या होगा. हाइपर एक्टिविटी इन अडल्टहुड मैनिफेस्ट इन द फॉर्म ऑफ फिजिटिंग एंड रेस्टलेसनेस, कि एक जगह टिक के खड़े नहीं हो सकते. यू विल सी दैट दे आर कॉन्स्टेंटली मूविंग देयर बॉडी, द लेग्स, द शेकिंग, और बेचैन रहते हैं, टर्निंग एंड टॉसिंग एंड शिफ्टिंग पॉस्चर, टॉकिंग टू मच, ओवर एनर्जेटिक, टायरलेस, थकते नहीं, सब कुछ भी करने लगते हैं वो उसमें. एंड ओवर डूइंग थिंग्स, कोई काम करने लगे ज़्यादा कर दिया, अनस्टॉपेबल. These people, apart from this, they also have emotional dysregulation. Emotional dysregulation is that. Emotional regulation is that all of us, we experience emotions, positive and negative, in response to our situations, circumstances, events that are happening around us. And then these emotional ups and downs, upsurges, they very quickly and very easily kind of come down, and you calm yourself down and you come back to a normal homeostatic state very quickly. तो ये इनमें डिसरेगुलेशन इज दैट दे आर नॉट एबल टू रेगुलेट. एक तो ये है कि गुस्सा हुआ तो कितना, खुश हुए तो कितना, उदास हुए तो कितना. तो उनकी जो एम्पलीट्यूड है या इंटेंसिटी है वो दैट इज़ टू मच, दैट इज़ देयर एंड देन इट स्टेज, इट डजंट कम बैक. तो वो या अपोजिट एक्सट्रीम पे जाती है. तो इमोशनल लेबिलिटी, वेरी स्मॉल स्टिमुलस एंड ए लार्ज रिएक्शन, दैट इज लेबिलिटी. इरिटेबिलिटी, बहुत जल्दी नाराज़ हो जाते हैं. एंगर आउटबर्स्ट, लो फ्रस्ट्रेशन टॉलरेंस, किसी चीज़ में उनको रोका जाए, मना किया जाए, अड़चन आ जाए, कोई किसी भी चीज़ में, किसी भी काम में, कोई भी वो करना चाहते हैं, अड़चन आती है तो वो बहुत परेशान होते हैं और वो उनकी फ्रस्ट्रेशन टॉलरेंस बड़ी लो होती है. मोटिवेशनल डेफिसिट्स, काम करने में इंटरेस्ट और अपनी जो एनर्जी है वो जो खुद करना चाहते हैं, खुद अपने आप से है वो ठीक है, लेकिन और कुछ करना है जो रिक्वायर्ड है, रिस्पॉन्सिबिलिटीज़, ड्यूटीज़, जॉब्स, टास्क, उसमें उनका इंटरेस्ट नहीं रहता है. तो दे हैव डेफिसिट इन देयर डिज़ायर टू डू दोज थिंग्स. इनएबिलिटी टू मैनेज नेगेटिव इमोशंस एंड हाइपर सेंसिटिव, दे आर वेरी टची, छोटी सी चीज़ पे नाराज़ होते हैं. Then they also have, because of these underlying difficulties of inattention, impulsiveness, प्लानिंग नहीं कर पाते ढंग से, पुअर जजमेंट है, पुअर कंट्रोल है इमोशंस के ऊपर, टाइम मैनेजमेंट नहीं है. दे हैव ऑल्सो लॉट ऑफ व्हाट वी कॉल एज एग्जीक्यूटिव डिसफंक्शंस. एग्जीक्यूटिव डिसफंक्शंस आर, दीज आर द काइंड ऑफ to execute certain function you are required to process a lot of information and kind of prioritize it, deal with it, and enact and carry the act through its several stages and to its completion. तो अपना वो गोल डायरेक्टेड जो एक्टिविटीज़ होती हैं उसमें इनकी they have these dysfunctions and these are in the form of low working memory, कि उनको चीज़ें याद नहीं रहती हैं. वो थोड़ा सा जो ये इसमें कंप्यूटर लैंग्वेज में रैम कहते हैं ना, रैम के कितनी रैम है, कंप्यूटर की एफिशिएंसी उतनी अच्छी होती है. तो उनकी ये जो वर्किंग मेमोरी है दैट इज़ काइंड ऑफ ए ब्रेन की रैम है. तो वो उनकी अगर कम रहती है और दे आर नॉट एबल टू काइंड ऑफ रिमेंबर थिंग्स वेरी इजीली. टास्क शिफ्टिंग, एक से दूसरी जगह शिफ्ट करते रहते हैं. दे कीप शफलिंग प्रायोरिटीज़, अच्छा ये कर लेते हैं, ये नहीं ये कर लेते हैं, अच्छा ये नहीं इसको ऐसे कर लेते हैं. तो उनका एक सिस्टम नहीं रहता. इम्पेयर्ड सेल्फ मॉनिटरिंग, उनकी सेल्फ के बारे में इंसाइट एंड जजमेंट इज़ वेरी लो. वो अपने में उनको दिखाई नहीं देता, समझ नहीं आता कि मैं ये गलत कर रहा हूँ, ये इसी से मेरी प्रॉब्लम हो रही है. प्रोक्रेस्टिनेशन, डिले करते रहना, वो उनका सेंस ऑफ जजमेंट ऑफ टाइम इज़ इतनी पोर होती है, नहीं टाइम है, कर लेंगे, अभी पहुँच जाएंगे, अभी तैयार हो जाएंगे, अभी चले जाएंगे. एंड देन इट कॉजेज यू लूजेज द one then loses the opportunity. Poor judgment of time and low self inhibition, अपने आप को नहीं रोक नहीं पाते हैं. Their sense of inhibitory control on themselves is very low. Now apart from this, these children, adults, they also have, because of these things, all these underlying difficulties which manifest in the form of their personality, organization, working system, and this leads to a lot of difficulties in their day-to-day life, in the domain of occupation, job and other things. And they also have higher rates of unlawful acts and criminal activity. Now this has been seen, ADHD children, on long-term follow-up, it's been found that a large number of them actually end up in using substances, alcohol, end up in antisocial behavior, criminal activity, unlawful acts, traffic accidents. ये उनका लाइफ की ट्रेजेक्ट्री रहती है. And these impairments that are there from childhood, in addition to this ADHD, there are also related neurodevelopmental disorders which are commonly co-occurring with ADHD. बचपन में जब ADHD होती है उनके साथ हम assess करते हैं, and a large majority of them They will also have what we call as SLD, specific learning disability, जिसको dyslexia आजकल कहते हैं. Now these learning disabilities, children, they also get a special concession in their CBSE exams and ICSE exams, in the educational boards exams. And so this is a form of intellectual disability, mental disability. Intellectual disability, autism spectrum disorder, epilepsy, brain disorder, these are commonly co-occurring conditions with ADHD in childhood. So when any one of these or more of these are present in childhood, such individuals, when they grow up to be adulthood, some of these problems also continue with them and cause additional difficulties to them. Job में क्या problem आती है उनकी? These people, they have higher levels of unemployment, they remain unemployed, frequent change of job. वो job छोड़ देते हैं, बार बार change करते हैं. Either they will get bored or not like it and impulsively resign and leave the job, quit the job, or they are kind of expelled and they are by the employer. And they have, when working, they have workplace impairments, reduced productivity. उनसे काम पूरा नहीं होता क्योंकि because of their difficulties, they cannot complete the job, so they poor productivity and increased risk of accidents, trauma, workplace injuries. ये होती है उनके. Reduced educational achievement, पढ़ाई लिखाई में थोड़ा सा backward रह जाते हैं, नीचे इतना higher पे नहीं जा पाते. And increased rates of, as I said, substance use and criminality. In addition, ADHD also contributes to many other psychiatric conditions, and when along the development, many of them develop what we call as mood disorders, affective disorders, that means like depression, mania, anxiety disorders, substance use disorders, and intermittent explosive disorder. This is a form of a personality disorder कि जिसमें intermittently उनका जो explosive outbursts of anger or they occur. So this is the total description of the syndrome of ADHD in adulthood. By listening to this, I am sure you would realize and understand that these kinds of characteristics or traits are generally seen widespread among population, and you would be able to identify many or few of some of your contacts that this kind of problems are present there. Now what causes it? It's a multifactorial condition. It's not one single factor. There are genetic factors contributing. There are pre, peri and postnatal factors. Now pre, peri, postnatal factors are that anything that impacts the brain, the developing brain, that is insult to the developing brain during prenatal phase, which can be in the form of maternal, febrile illness, exposure to any drugs, any toxins, any trauma, any other illness or so on. So that can be adverse, will have adverse impact on the growing brain. Perinatal is any birth-related trauma, delayed, birth and any birth anoxia or any complication during birth. Postnatal factors again during early development, if there are any adversities like separation from mother or any nutritional deficiencies or febrile illness or epilepsy or brain trauma or any postnatal condition will have effect, any physical illness. Then other contributing factors are environmental factors, poor living conditions, poor parenting. Children, it's been seen that children who are born in poor conditions, low socioeconomic status, these children, they have multiple adverse factors that they are exposed to. Not only that they have a poor nutrition, poor hygiene, cleanliness, more exposure to infections and diseases, and also, I mean, these are the children who are born to these laborers and daily wage workers. So there is poor parenting. Parents are not involved in the child care at the young age. They leave the small little infants by the side, and while they are working, the mothers are working as a laborer. So poor parenting. So poor parenting includes poor control and poor care. Care is nurturance, taking care of them, looking after their needs and requirements and everything, so that is not done. And also no control, unko koi kuch kehta nahi hai, they are kind of just growing up by the side wildly. So these children, they tend to become more like ADHD children. Exposure to toxins, viral infections and medication. Now this is something in the environment we are experiencing every day, and with increasing intensity and load, increasing load of toxins, environmental toxins, the air we breathe in, the food that we eat, the additives, the preservatives, coloring agents. And now we see this more and more trend of these paper cups and paper glasses. Paper cups and paper glasses, drinking tea, hot liquids in these paper cups and in the paper ki katoriyan jisme garam garam khana milta hai, khate hain. Now this paper is not food grade, it's not tested for, it's not safe, it's just a paper. And paper, we all know, is kind of a chemically treated sort of a thing, and then with the hot liquids, it becomes, I mean, it will release a lot of toxins. And so I mean, these are the small little things in our living style and habit unknowingly we are taking in, and which is contributing to not just this neurodevelopmental disorders, but also cancer and so many other the conditions in us. Viral infections and medication. Medication, sometimes children who are given, they are on asthma medication, so that can cause in them something which is akin to hyperactivity, because that's a stimulant, ethylene, salbutamol. So we need to look at that. Diet, I have already said. Also, diet which is very rich in sugars, and that we know, we have seen that high sugar leads to a kind of a general rush of activity and so on. Any brain insult or brain disorder, and any other neurodevelopmental disorder, if it's present, it contributes to ADHD. Now these individuals, what they have is also neurocognitive deficits. Now this is, as I said, is a brain condition. It arises from dysfunction in the brain. So during development, there are structural and functional impairments in the brain that are there, and these are related to frontal and subcortical dysfunction, which actually contributes to our executive function. And our memory systems and information processing systems, they are also impaired during development, and that contributes to ADHD. And on structural imaging and functional imaging, it has been seen that there is evidence of structural brain abnormalities in ADHD. They have smaller volume in the frontal cortex, cerebellum and subcortical structures, and in the prefrontal and in the parietal circuits. Then they also have dysfunction in the basal ganglia, caudate, putamen and globus pallidus. Now these three subcortical structures, they are a part of neural circuitry that underlies motor control, executive function, inhibition of behavior and modulation of reward pathways. So these are the kind of areas of dysfunction, the basal ganglia, and we know that these children, or individuals, have difficulty in inhibiting their own behavior. So the inhibitory control over emotions and behavior is missing or compromised in ADHD. And these frontal striatal thalamic circuits, they provide feedback to cortex for regulation of behavior. And the studies suggest that subcortical structural abnormalities which are seen in childhood, studies of ADHD, they normalize into adulthood, but cortical abnormalities persist. Also, there are neurotransmitter impairments, dysfunction, and the catecholaminergic neurotransmission is impaired in several brain circuits. So there is hypoactivity of dopamine and norepinephrine in frontal and subcortical circuits. Noradrenaline and dopamine, they exert neuromodulatory influence on behavior and cognition through frontostriatal cerebellar circuitry. And ADHD medications that I will just talk about, that those medicines, they block the dopamine transporter or norepinephrine transporter, thereby increasing the free brain levels of noradrenaline and dopamine, and which contributes to improvement in their behavioral functioning. Genetics, as I said, there is a genetic contribution. There is a heritability estimate of 76% based on pooled data from twin studies, and risk of ADHD in parents and siblings of children with ADHD is higher, 2 to 8 times higher than the population where there is no family history of ADHD. There are several genes are implicated in the etiology of ADHD, and although the effect is small, but nevertheless all these are there. My time is up. Okay. And so these genes are there: polymorphism of dopamine transporter gene and DRD4 gene. So assessment of these for management, I mean, we need to do a very good history taking and do a complete assessment of developmental history, take information from multiple informants, preferably parents and also spouse or any peer colleague, and try to rule out other disorders like mood or anxiety disorders, and neuropsychological testing. We need to assess not just for the presence of neurobehavioral syndrome of ADHD, but also other mental health conditions, any other associated medical condition like thyroid disorder, hypoglycemia, seizure, or any history of medication, steroids, anti-asthmatics, and also assess for substance use disorder and cannabis. Management is again multimodal. I'll very quickly finish in about 2 minutes. Multimodal management that comprises of medication, comprises of psychological therapies in the form of counseling and psychotherapy, and one very important mode of therapy is cognitive behavior therapy, psychoeducation, and skills training. Medication is psychostimulants primarily are the mainstay of drugs, medication that is used. Amphetamines are useful, but they are not available in India, so we don't have it, we don't use it. We have methylphenidate available and we use it. We use it across the board in children and also is used in adults with significant benefit. The dose in adults is 20 to 40 milligrams a day, maximum 60 milligrams a day. Other non-stimulant medications are atomoxetine, bupropion, and antidepressants. Now, antidepressants were the group of drugs that we were using before methylphenidate became available to us in India. So these stimulant medications can reduce the core symptoms of ADHD, but there are other disturbances in their functioning and in their interaction, in their social life, personal life, working life that stays. So for which we use psychotherapy. Improving time management skills, reduce impulsiveness, to have better problem solving skills, better coping skills, improve self-esteem, improve relationships with family and co-workers, and develop strategies for anger control. Now these are the objectives and the aims of psychotherapy. Cognitive behavior therapy is very effectively used, that focuses on organization and prioritizing tasks and planning of tasks. The simple kind of methods that are used in CBT are systematic use of tools like we advise the patient to use a timer, a planner, maintain a diary, maintain a task list, prioritize things, and be aware of more timing, self-monitoring, cognitive reframing, and other methods of intervention, mindfulness-based cognitive therapy, neurofeedback, these are also useful. Usually the condition persists from childhood to adulthood in 40 to 60% of cases. And mortality rates are high in persons with ADHD compared to persons without ADHD, and accidents are the main cause of death in these children. This is the last slide. How to cope? These are kind of a simple tips or a common tips to lead a well-adjusted life despite you having ADHD. I think some people who develop good insight or have some understanding or insight about their problems and are willing to take some kind of a corrective step for themselves. So we kind of advise them to use simple tips like use organizational planner, journal, that like writing kind of, or recording or maintaining a diary, make a to-do list, plan the day a night before, start with the easiest thing and then move to the more difficult things, set timer or alarm activities. You must have seen the youngsters these days, वो हर चीज़ के लिए बिल्कुल टाइमर लगाते हैं और वो अलार्म लगाते हैं. दे डोंट वांट टू एलोकेट देयर ब्रेन रिसोर्स टू रिमेंबरिंग थिंग्स. वो दिमाग इस्तेमाल नहीं करना चाहते, वो हर चीज़ के लिए टाइमर लगाते हैं और ये सब लगाते हैं. एंड इन दीज डेज विद इंटरनेट एंड एक्सेसिव यूज ऑफ कंप्यूटर्स एंड ऑल दैट, चिल्ड्रन आर मोर एंड मोर गेटिंग इनटू these symptom complex of ADHD. Inattention is actually increasing a great deal in them. And so work in intervals, एक ही सारा काम इकट्ठा नहीं करना, छोटे छोटे gaps ले लो, and avoid multitasking. Now that's these individuals, they do, वो 4-6 काम इकट्ठे खोल लेते हैं, ये भी करना, ये भी करना, ये भी काम पूरा कोई नहीं हो रहा, सब के सब बिखर गया. तो उनको बोलते हैं कि ये मल्टीटास्किंग नहीं करना, one thing at a time. And वर्क इन ए काम, क्वाइट एंड अनक्लटर्ड एनवायरनमेंट. ऐसी जगह में बैठो जहाँ काम करने के लिए बैठो जहाँ शोर शराबा नहीं है, बहुत सारा सामान नहीं है, बहुत सारी चीज़ें नहीं हैं, सो दैट एनवायरमेंटल एक्सटर्नल काइंड ऑफ डिस्ट्रैक्टिंग इन्फ्लुएंसेस आर मिनिमाइज्ड और लेस ऑन देम, जिस पे वो फोकस कर सकते हैं. एंड these are the kind of simple tips that are given to them. And I think many of them, these people, they don't even come to us psychiatrists. They come to us only when there is a problem, some kind of a problem at job or accident or any other problem with the law or some such thing. तो तब वो हमारे पास आते हैं, या अगर एंग्जाइटी हो गई, डिप्रेशन हो गई, अल्कोहलिज्म हो गई, तब आते हैं. एंड वी फाइंड दैट देयर इज अंडरलाइंग ADHD. सो अंडरलाइंग ADHD हैज़ टू बी आइडेंटिफाई. करोगे बिना ADHD को ट्रीट करते वो पूरा नहीं होगा उसका, तो वो करना पड़ेगा हमें साथ में. सो दिस इज समथिंग विच ऑल ऑफ अस हैव टू बी वेरी अवेयर, and for overall complete holistic management of patients, keep in mind and also simultaneously manage it. Thank you very much for your attention.
Thank you, Dr. Malhotra, for elevating the level of knowledge in our brains in post-lunch hours on such an interesting and difficult topic. I thank Dr. Anubha also for such a beautiful talk to be considered for the AMACON. As a customary, the question answers are not taken in oration. If someone has any question, please remove your doubts by meeting Dr. Savita personally.
Sure.
Thank you very much. Thank you.
To felicitate our speaker, I request Dr. Subodh Jain, President AMA, President-elect Dr. Kamal Singh sir, all the organizing secretaries of today's conference, Dr. Mohit Jain, Dr. Anurag Verma, and Dr. Lalita Shukla ma'am, Dr. Ashutosh, Secretary AMA, Scientific Secretary Dr. Anubha, I request Dr. Kamal Singh sir to please felicitate the chairpersons. Dr. AP Singh sir. Dr. VK Singh sir. Dr. Subodh Jain sir, please felicitate Dr. Pankaj Gupta.